We will be on in a minute. And we will be on in a minute. I knew I was going to do that. And now I can't even find. We will be on in a minute. Space. I knew I was going to. So, welcome. Welcome to Medical Mondays with Dr. O. Let me expand my screen. There we go. I'm Dr. Toyin Opesomi, a family practitioner, HIV specialist, and I treat addictions in Maryland. I'm always excited to be here on Monday nights because I learn so much on this forum. I'm grateful for this forum where we learn to prevent disease entities, sometimes treat, get interventions, and get our questions answered. Tonight, we have one of our very own, Dr. Shola Bankole. Dr. Bankole is an amazing physician, gentle, one of those I call gentle giants. She's an ER physician and she practices in Texas. She came to the United States practicing medicine or started practicing in 2011. She considers her faith and her family to be most important to her, to be a pillar. And importantly, she's a child of God and has been called and chosen by God to shine forth the light of Jesus Christ. She excites me because she's proud of who our pillar is, the Lord Jesus. She's joyfully married to Pastor and engineer Isaac Bankole, who we have the privilege of having here tonight and who has already educated us just before we started the program tonight. The couple are blessed with 4 wonderful children, Enoch, Elijah, Emmanuel, and Ezekiel. And I have had the privilege of enjoying all the children as well as them, So tonight she'll be talking to us about something that is plaguing our society for some reason. And people have been requesting that we talk about this. Intracranial, sorry about that, to talk about intracranial bleed. I need to apologize because I got text messages asking me what intracranial bleed is. I usually don't write medical jargons as topics or even speak jargons on this forum. Somehow I made a slip on this one. Intracranial bleed is bleeding in the brain. Not a good thing. So without much ado, I'm going to yield the floor to our precious Dr. Shola Bankole. The floor is yours. And welcome.
Thank you so much, Ma. Thank you so much, Ma. Thank you so much, Ma. I truly appreciate you, Ma. Thank you for giving me this floor, the privilege and the opportunity just to talk about intracranial bleeding, brain bleed. And I just want to thank you also for what you're doing on this forum, just creating awareness out there for people. So thank you so much, Ma. Good evening, everybody. My name is
You're
Shola
welcome.
Bankole. Thank you, sir. Just like Mumi has said, my name is Shola Bankole. I am an emergency medicine room doctor. So I take care of emergency cases like patients with emergent problems. And I've been doing this since 2011. I practice in Beaumont, Texas. And today I'll be talking about brain bleeds, the different type of brain bleed, what they have and what we need to know and how to seek emergent medical help when it comes to brain bleed. So we're going to go straight into it. I'm going to dive straight into it because of time. Okay, can everybody see my screen and the mouse?
Yes, we
Yes,
can.
yes, it's
Yes.
clear
Okay, good.
enough.
Yes.
Okay, good. So this is just the agenda, just talking about the causes and the type of brain bleed we have, the symptoms you see with brain bleed, and the treatment and the management. And at the end of the case, of the PowerPoint, there's some cases I want us to kind of run through. Just give me a little minute of your time. On this screen, you can see a picture on the screen. I just want everybody to kind of glance at the picture of the screen. And the screen is a CAT scan image of the brain, a CAT scan image of what a normal brain actually looks like. Is a slice of a CAT scan image. And the reason why I'm showing you this picture is that later on, we're going to be seeing some abnormal pictures of the brain. So that way we can familiarize ourselves with what a normal brain looks like. When you look outside of this picture, on the outside of this picture, that is just the skin. We call it a scalp. It's the skin that covers the skull. So when you pinch on your skin up here, that is your scalp. It covers the skull of the brain. And when you look next to the skin is the bone. This white thing you're seeing, I have my mouse going around it, is the bone of the brain, is the skull for the brain. You can see how thick it is. God has given us this thick bone to protect our brain. And right before you get to the brain, I can't see it on this picture, and you also cannot see it on this picture. You can only see it with the naked eyes. Right before you get to the brain, there's a covering that covers the brain also. It covers the brain. So there's multiple layers that God has given to us to protect this brain that is very precious to us. Because the brain is the map to the whole entire body. So anything that affects the brain will affect the body. You can see in this area of this brain, on this picture, there's the gray area. It looks uniform around, it is gray. And this is what a normal brain looks like on a CAT scan. And right here in between, let me go back. In between is the black area. We call them the ventricles. This is what they usually look like. They are normal right now. And this, the brain itself, the gray looks all uniform. You don't see any other color that is not supposed to be there. You're not seeing that there. So this is what a normal brain scan looks like. So when they do a brain scan, when you go to the hospital, they do a CAT scan of the brain on you. This is what a normal brain scan is going to look like. So let's go to introduction. So mommy mentioned, she sent, Dr. Ho had mentioned she sent intracranial bleed. What is intracranial bleed? Literally, intracranial bleed means brain bleed. It means brain bleed. It means bleeding inside the brain. And when you see that, that is abnormal. I have a picture out here showing you what an intracranial bleed means. I showed us in the previous slide what a normal brain scan looks like. When we now go to this picture right here, the one I have my mouse over, you can see the white parts in this CAT scan. Previously, it was gray all over. That's what a normal one. But this one you can tell is abnormal. This is a bleed inside the brain. The white part is blood inside the brain. And that is abnormal. That should not be there. So that is what a bleeding in the brain, what it means, a brain bleed. This is what it means, really. Now, why are we worried about the brain bleed? The brain bleed itself is not the problem. It's the effect that the brain bleed causes. And that's the problem, is the effect of it. You can imagine the brain, when you look at your head, right? Your head is really small, and your skull, you have the bone, the skull around it, and you have the brain filling that area. There is no space for nothing else. I mean, the best way to put it is you have the brain. When you have anything else filling inside the brain, it's going to push the brain to one side because there's no space inside the brain. There is no space inside the vault of the brain to fill up with anything else apart from your brain. And so this is why we worry about brain bleed, because what the brain bleed does is it causes pressure inside the brain that pushes the brain to one side. And in this picture, you can see what is the effect of the brain bleed in here. You can see what it's doing already, because when you look at this line right here, it's supposed to be straight, but you can see that the bleeding in this brain is pushing the line to the left side. You can see it pushing to, it's causing a mass effect. And when you have a mass effect in the brain, it leads to neurological dysfunction, and it can lead to death also. In most cases, if there is no emergent intervention, people die from this. So a little statistics on what we see with brain bleed, right? Each and every year, about 12 to 15 people per 12 to 15 per 100,000 individuals develop brain bleeds. 20,000 in the United States, just in the United States, annually die from brain bleed. That is a lot of people, a lot of individuals that die from brain bleed. Intracerebral hemorrhage, or I would say brain bleed, has a 30 days mortality, meaning that 44% of people that develop brain bleed within 30 days will die. That is pretty high. So, and the incidence of brain bleed increases in individuals older than 55 years and older, and every decade it goes up. There are two major types of brain bleed. There's the one we call the spontaneous brain bleed, the non-traumatic ones, meaning you don't have to do anything, it will happen suddenly. And there's the one we call the traumatic brain bleeds. The traumatic brain bleeds are usually when you sustain an injury, either you fall down, or there was a trauma to the head, or motor vehicle accident or motorcycle accident with a fall to the injury to the brain can lead to brain bleeds. So I'm just going to run through real quick these two major types of brain bleed. The spontaneous brain bleed is usually when you have bleeding inside the brain. There's bleeding forming inside the brain. It's usually spontaneous. You don't have to have an injury. You don't have to fall. It doesn't have to be traumatic. It's spontaneous. And the number one cause for this spontaneous brain bleed is high blood pressure. People with uncontrolled blood pressure, people with chronic blood pressure, with their blood pressure uncontrolled. Some people, they have high blood pressure, they've been living with it. I call them the walking dead people, because their blood pressure is so high, they don't know they have high blood pressure until something like this happens and they are rushed to the emergency room. So it is highly recommended we keep our blood pressure under control by taking medications, exercising, and all that to prevent this from happening. This type of bleeding, the spontaneous bleed that happens inside the brain, is associated with a high mortality and morbidity, meaning that the risk of dying is very high. There are secondary causes of intracranial bleed, brain bleed also. The ones we call the secondary causes are the ones that these people have underlying structural pathology. They have underlying problems with their brain. So for example, an example of that is brain aneurysm. A lot of us have heard about brain aneurysm, but we don't really know what it is. There's a lot of people out there that they do have brain aneurysm, but they don't know they have it until one day the brain aneurysm rupture. I had a case of a young patient, 27 years old male, actually, never knew he had aneurysm. He was sitting in the back of his car with his little daughter, and this guy just died, just like that. By the time they did the autopsy on him, they found out he had a brain aneurysm that ruptured, that killed him just right on the spot. So, one of the things that secondary brain bleed, as we've discussed, that is spontaneous, could be brain aneurysm, could be AV malformations, on all the medical jargons. I'm not going to mention them, but we kind of get a little gist of what spontaneous brain bleed is. And then there is the I mentioned this is the same thing also, just talking about the different types of spontaneous brain bleed. We have high blood pressure, ruptured aneurysm, ruptured AVN. Sometimes people who have tumor, brain cancer, they don't know they have brain cancer, and all of a sudden it starts bleeding and they start having neurological deficit, neurological effects from it. People on blood thinners. Nowadays, everybody applies, everyone, you cough, you sneeze, they put you on blood thinners. And it's okay because some people have they've been diagnosed with multiple blood clots to the lungs. People with heart stent, if you've had a stent before, you're placed on blood thinners. If you have what we call atrial fibrillation, you're placed on blood thinners. So people on blood thinners are also at higher risk of developing spontaneous brain bleed. People who abuse street drugs like cocaine, methamphetamine, PCP, alcohol, excessive alcohol drinking, because you drink alcohol, you get drunk, you fall down, hit your head, develop brain bleed from there. So there's increased risk of developing brain bleeds. The second type of brain bleed is the traumatic. So we talked about the non-traumatic ones, the ones that are very spontaneous, that can happen all of a sudden, and the ones that are traumatic. These ones are due because of they're due because of brain trauma to the brain, right? It could be a blunt trauma, meaning you fell down on the concrete or something, or it could be like a stab to the brain that can lead to brain bleed. Like I said earlier, people on blood thinners like warfarin, like Plavix, like Eliquis, they are at a higher risk of developing traumatic brain bleed. So the types of traumatic brain bleed, usually epidural brain bleed. I'm going to talk about this in details. This one is the one that can happen acutely after a trauma, and the mortality for this is very high. Like if they don't seek immediate medical attention, they can die from this. I have a case about this later on in this PowerPoint we'll discuss. There's the subdural brain bleed also. Sometimes this bleeding can be slow bleeding. It could be acute, it could be subacute, it could be chronic. These are the elderly ones you see, they fall down with, and then a week later, they are not acting their usual self. Usually this is from a subdural bleed. And then the intracerebral hemorrhage, which is brain bleed also, I mentioned that earlier, is bleeding inside the brain. And then the subarachnoid hemorrhage, subarachnoid bleed, could be traumatic. And usually these ones are people who present with what we call severe headache. They will tell you it's the worst headache of their life when they come in presentation. So we're going to look at a case study on each of these type of brain bleed later on. What all of these bleeding have in common is that most of the time they come with the same presentation. The same presentation, right? Most of the time when they present, there is an alteration in their level of consciousness. So sometimes they are unconscious. They are not acting their usual self. They are weak. Sometimes I remember a patient coming to me, they said, oh, the smell, they were smelling something different. Some people is behavioral problems. They start acting out, they start cursing, and it's very unusual for them to do that. Most of the time, about 40 to 50% of time, people with brain bleed will have nausea and vomiting, excessive nausea and just throwing up, vomiting. 40% of the time, they will come with headache, severe headache, which is why we have to pay attention when you're having headache, pay good attention to it. Seizures also, when people present with first time in their life having seizure, they've never had seizure before, could be because of brain bleed. People sometimes will present with weakness on one particular side of their body or their face. It could be from brain bleed also. Sometimes it's numbness meaning you cannot feel it. Tingling, people describe tingling like an electric shock going down their body. That could be a sign of brain bleed. Also weakness. They have a weakness in a particular part of their body, could be a part of a sign of symptoms and signs of brain bleed also. People who have had trauma to the brain, people who use drugs, people on blood thinners, they are at a higher risk of having brain bleed. So with a history like that, especially high blood pressure, and they're having symptoms like this, it is of necessity for them to seek medical attention immediately. So what do we do for these patients? What do we do when they come to the emergency room? Usually we run blood work on them. We check their hemoglobin just to make sure it's not too low. We check their platelet and their coags. We call it coags. They are the blood thinning enzymes we check to make sure they are not too thin and to see that if it's something we can reverse. The key thing is getting a CAT scan of the brain. MRI maybe later on, but CAT scan of the brain is of essential for any kind of brain bleed. The rapid diagnosis of brain bleed is very essential. If there's a delay in it, I tell people time is life, right? Any delay in the diagnosis of a brain bleed can lead to death of that patient or neurological dysfunction of the patient. We used to do lumbar puncture for brain bleeds. We don't do it that much now just because the CAT scans we have now are of higher technology and we can diagnose a lot of brain bleeds on CAT scans. So what is the treatment for brain bleed? Most of the time we do, if they are very small bleeds, we will admit the patient overnight to the ICU, monitor them. Within 24 hours, we'll get another CAT scan just to make sure the bleeding is not increasing. What we also do is we stabilize the patient. Especially if the bleeding is a lot. So what happens with a brain bleed is that because the bleed is so much, it's pushing on the brain, it takes out the reflexes to breathe. So on people or patients that come in with big brain bleed, we most of the time put them on ventilators. We intubate them to protect their airway. Like I said, early treatment is very important and is the key as it may decrease bleeding enlargement and lead to better neurological outcome. So time is life in this case. Timing is very essential. So, and I tell patients, once you start feeling bad, once you start feeling the severe headache, don't wait it out. Just go. Go to the emergency room, go to the hospital, seek immediate medical intervention, and that can save lives. One of the things we also do in management of brain bleed is to manage blood pressure. Like I said, high blood pressure is one of the leading cause for brain bleed. And so when a patient comes in with brain bleed, we give them medications to lower their blood pressure. Most of the times, if there's a surgical intervention needed, we do emergent consultation with neurosurgeons and neurologists and intervention radiologists to drain the blood. Sometimes the blood needs to be drained immediately to release pressure in the brain and for a better outcome. So we're going to go through some cases really quick. And I have this case right here. Can everybody see the screen? I have a case of a 42 years old white female. 42 years old white female who presented with severe headache for 2 days now. Severe headache for 2 days with nausea and vomiting and lethargy, right? She's feeling weak. She's been having this problem for 2 days, severe headache. She has high blood pressure, has not been taking a blood pressure medicine, nausea, vomiting. This is what we call an intracerebral or intraventricular hemorrhage, cerebral intraventricular brain bleed. Because why? You can see the white part, the bleed inside the brain. You can see the bleed inside the brain. And so in a case like this, the prognosis is not so good. Like I said, it's mostly caused by high blood pressure. It has a poor prognosis with expected mortality between 50 to 80%. And the treatment is mainly to just manage the blood pressure, to bring down the blood pressure and decrease the intracranial pressure also. Most of the times, this might need to go to the operating room for surgical intervention. And in cases like this, we protect the airway of the patient by putting them on the ventilator and intubating them. We do a emergent, we give them seizure prophylaxis because of this space occupying lesion bleed that is pushing on the brain. They are prone to get to have seizures. So we do seizure prophylaxis by giving them medication for seizures. And we do a neurological consult for possible surgical intervention if they need one. So we're going to go to the next case. And in this case is I actually saw this patient in the emergency room about 2 months ago. This is not the exact picture, but it's something similar like this. So this is a 35 years old white female or 35 years old female presented by the ambulance with continuous seizure and was found altered by the spouse on the ground in the house. She was unresponsive. The last time he heard from her was 8 hours ago. The spouse said in the last few days she's been having some strange smells. So this was a patient that the spouse left her in the morning. She had 2 children in the house, left her in the morning, and never really heard from her, which he felt it was unusual. And when he got home at 4:30, found her on the ground actively having a seizure. She was unresponsive, and he saw the little children. They've not eaten since morning. The diapers have not been changed. So he knew she has been on the ground for over 8 hours. So he called the ambulance and they brought her immediately to the emergency room. When they brought her to the emergency room, we did a CAT scan. When she got to the emergency room, I immediately protected her airway by intubating her. So like I said, we kept her on the ventilator just because she was unresponsive. And this was a CAT scan, something similar like this. And you can see on this CAT scan, if you can see my mouse, you can see how she has this white stain. And then around this white area, there's a swelling around that area. We call this edema, swelling. It's just really swelling around where the bleed is at. There's a brain bleed. And on this thing, you can see is a tumor. It's a big mass, in the brain with swelling around it. And this was on a young lady. So what is the, majority of brain bleed, apart from blood pressure, apart from aneurysm, can come from tumors also, can come from cancer, especially the ones that are highly malignant and very poor prognostic cancer. You can see that in younger patients or even older patients also. The prognosis is not so good on cases like this also. The next case we're gonna go is what we call an epidural bleed. I'm not sure if every one of us are familiar with this actress. She was the actress in the movie called Parent Trap. I think she died around 2008, 2009. And she had, she's a 45 years old white female who sustained a fall after a skiing accident. She traveled to Colorado, to Canada to learn how to ski. And while she was skiing, she fell down. Initially, she refused treatment because she was fine. But later, she developed a severe headache and she was taken to the hospital. 2 days later, after the fall, she died. And why is that? It's probably delay to the time of treatment. This is what we call an epidural bleed. You can see this white part of the brain. This is blood that is pushing on the brain. And what happens is this bleeding will continue, may continue until it's being stopped or and it causes pressure to the brain. So until the pressure to the brain is released, it can lead to mortality. It can lead to death. And how do they release pressure to the brain? Literally, in the ER, we call it a borehole. They will create a hole in the skull to release this bleed out. So there's a release that to help release it. And if this is not done in a timely manner, the patient can die, the person can die. So the epidural bleeding is what we call the talk and die syndrome. This is somebody who fell down, they got up, they are fine, they're talking to you, and few hours later, they are not responding. They lose consciousness, and if care is not taken, they can die from that. So it's a life-threatening condition which may require immediate intervention and can be associated with significant morbidity and mortality if it's left untreated. So therefore, with an epidural bleed, rapid diagnosis of it is essential, and evacuation of the bleeding is very good for good prognosis and outcome. This is another type of bleed. This is an 80 years old white female who is on a blood thinner, who slipped and fell yesterday. And then today she's acting strange and she's weak all over. It doesn't matter what race they had. It could be white, it could be black, or they fell down about a week ago and today they are not acting their usual self. And it does not matter if they're on blood thinners or not. Anyone with a fall and start acting strange, it is very important they seek emergent medical attention. So we can see in this, we call this the subdural brain bleed. Subdural brain bleed. You see this area in the brain where the blood is pushing and squeezing on the brain itself, on the brain stem, on the brain itself. You can see how this brain is being squished to the right side of the brain. That's not good. If you look on this other image, this is an old blood that's been building up in the brain. And you can see is pushing the brain to one side. I had a case of an older man who came to the emergency room. And his CAT scan was like this one in the middle. Slowly, old blood in the brain, slowly pushing on the brain. His son-in-law, thank God his son-in-law is a doctor who realized that there's something up with this man, immediately carried him to the emergency room. And immediately we took the man to the operating room. They were able to evacuate the blood in the brain, and you could see significant changes in this man 30 days out after the brain bleed has been taken out. Able to walk, able to function, able to do the things of life like he usually does. So it is very essential to rapidly understand what's going on and rapidly seek medical attention for a better outcome when we have bleeds like this. So just like the image I've shown you, this is what we call a subdural hematoma. It's a pool of blood between the brain. It can become a medical emergency if it's not taken care of immediately. The symptoms, like we've discussed earlier, is like headache, confusion, vomiting, slurred speech. Your speech is not sounding right. For some people, it's just coma. They just go into a coma and they don't wake up from that. This is another case on a 40 years old male who presented with sudden headache, the worst headache of his life that started after his daily workout. After exercising or exerting himself, he started having this severe headache. Sometimes they will call it a thunderclap headache. We've heard when the thunder sounds, it does brrr. When people have this type of brain bleed, we call this a subarachnoid brain bleed. It is sometimes referred to as a thunderclap headache. And people who have what we call severe headache, they will actually describe it as the worst headache of their life. It needs emergent evaluation. Usually it can be caused by trauma, or sometimes it can be caused by a brain aneurysm that ruptured. So people who have never had they know they had brain aneurysm and it just ruptured, and they will present with the common sign of it is just like I said, is sudden severe headache, and it sounds like a thunderclap headache, and they will tell you it's the worst headache of their life. And usually this can happen in people between the ages of 40 and 60, but can happen to anybody. Can happen to anybody. So risk factors for people who are most likely to have this subarachnoid hemorrhage that I just described is usually people with unruptured aneurysm in their brain or in other parts of their bodies. They don't know they have, or they know they have aneurysm in other part of their body. It's essential to seek medical help to check to make sure you don't have a brain aneurysm in your brain. Anyone who has had a ruptured brain aneurysm is at risk to have a subarachnoid bleed. Anybody who smoke is at risk of having a brain bleed. High blood pressure, I can't emphasize that enough. High blood pressure, uncontrolled high blood pressure can lead to all this type of brain bleed. Anyone with weak muscles, connective tissues of the brain, anyone with what we call a polycystic kidney disease, usually is hereditary genetic polycystic kidney disease. If you know you've been diagnosed with that, it's essential to check to make sure you don't have a brain aneurysm. Anyone with substance abuse use like cocaine, methamphetamine, PCP, I mentioned excessive alcohol consumption, they are at a very high risk to get this type of brain bleeds. Anyone on blood thinners, just like warfarin. Warfarin, like, also can be another name for warfarin is Coumadin. Blood thinners like Eliquis, blood thinners like Xarelto, all those blood thinners. Anyone on blood thinners, Brilinta, anyone on blood thinners is that they are at high risk to get brain bleed. A strong family history of aneurysm. If anyone in your family have had aneurysm, is essential you get checked to make sure you don't have a brain aneurysm. And the treatment is really, with a brain aneurysm, is to stop the bleed where the bleeding is at. Most of the times, the neurosurgeons and the interventional neurosurgeons, what they do is they go and they put a coil where the bleed is to stop the bleed from progressing. Like I said, brain aneurysm is a bulge or a weak area of the blood vessel in or around your brain. Most of the times they are small and they don't cause any problem. But when they rupture, they can become a life-threatening problem. And the very first sign for any ruptured brain aneurysm is a severe headache. Severe headache. So this is just a little summary of all the bleeds we've talked about. And we can see the pictures of all these bleeds right here. You can see the very first one is bleeding inside the brain. We call that intracerebral bleeding, bleeding inside the brain. Usually it's caused by high blood pressure. It can be caused by trauma. It can be caused by brain aneurysm. It can be caused by tumor. And people present usually, they have sudden severe headache, nausea, vomiting, numbness, tingling. Most of these presentations are usually the same when it comes to brain bleed. We can see right here also in this picture right here is what we call a brain bleeding inside the ventricles of the brain. Bleeding inside the ventricles of the brain. These two carries the most mortality because you're bleeding inside the brain. And then we have the subarachnoid bleed. This was the last one we talked about, that people present with severe headache. They will tell you thunderclap headache, usually caused by brain aneurysm. Usually caused by brain aneurysm. And then we have the subdura, which is the one right here. You can see, usually you see this in the elderly. Usually it's caused by trauma, and they will present with maybe 2 days or few days after a fall Initially, after a fall, they are fine, but then few days later, because this kind of bleeding is a venous bleed and it slowly accumulates into the brain. And the last one here is the epidural bleeding, the one we talked about with the heart rest, the one the heart rest died of. Is a brain bleed that is very acute, meaning that it can be very life-threatening if it's not taken care immediately. They are the ones we say the talk and die syndrome, because they are talking to you this very moment, and then in the next 1 hour, they are unconscious, not responding. So it is very essential that immediate medical attention is seeking immediate medical attention is of essential when you start having severe headache with being on blood thinners, severe headache with history of high blood pressure. Is very essential to seek immediate medical help, just because time is life, and if the diagnosis can be rapidly diagnosed, then there could be immediate emergent intervention that can save a life. And I just want to say thank you so much. And this is all. I'll leave the rest to question. I have my book out here. I know Dr. O said she was going to talk about it later on. We launched this January. Is Beyond Birthing Impossibilities. Is not to do with brain bleed. Is a different topic entirely. But is available on Amazon for purchase. If anyone is interested in getting one. And that's it.
Thank you so very much. Appreciate you so much. That was excellent. While you have the book on, I was waiting for more of our family to come in, our Medical Mondays family, so I can talk about it together, but we might as well talk about it now. This book is an amazing book for people, women who have had children by C-section and wishes to have delivery by the normal vaginal delivery. Our doctor here actually, after 2 C-sections, was able to have our last 2 children the natural way by, we call it VBAC. So that's vaginal birth after C-section is what VBAC means that you see up here. It's a great book. It's a book that you can buy and gift to new mothers or mothers that have had C-sections. It's a book to give to encourage. So I recommend it. We'll bring it up again at the end of the program. So thank
you so much, man.
Thank you so much. So if you pull this down so I can see the hands, thank you, of those. Oh, I see that Dr. Oduyebo have your hand raised and people are clapping for you. They are, appreciative of your presentation. I saw earlier that Zubar from Nigeria, believe it or not, is up at this time from Nigeria, said earlier on that, I want to read it. I don't want to quote it. I don't want to misquote. He said, I'm in love with your presentation, Dr. Bankole. And he gave the, strong arm. So thank you so much, Zuban. Thank you, Dr. Bankole. Dr. Duyebo, kindly unmute and ask your question.
Thank you and good evening. Very resourceful and informative presentation. It actually added to my knowledge of brain aneurysm. I was a victim of intracranial pressure headaches that was very severe. Never had headache in my life. And in 2014, I was out in Virginia, and all of a sudden they started. I realized that I took a leave around that time, and I was told that a leave was a blood thinner, which I never knew. I was taking it for headache. For pain. I never had headache until that day. Thank God my wife had to rush me. She drove all the way. It was like somebody was putting a sledgehammer to my head. We got to the emergency room and they did immediate surgery at that time. My question is that the aneurysm that I experienced was something very unusual. However, it came as a surprise. It was too sudden for me to even be able to know what was going on. But my question simply is that what can anyone do to reduce the impact of head trauma for children that play football in this country? Thank you.
Dr. Bankole, question: what can one do to reduce the incident of head trauma in children that play football?
So the very first thing, I'm not a neurologist, but I know the key thing they enforce is helmet, for children, and even for anyone really. If you're going to be riding your bicycle, we encourage helmets. If you're going skiing, we encourage to have your helmets. Motorcycle riders, we encourage helmets. You'll be surprised how many lives are saved by just wearing helmets, because it protects the brain, the skull.
That's correct. And Dr. Uduyebo, thank you so much, Dr. Bankole, actually. Dr. Uduyebo, congratulations. We're glad you're still here with us. And thank you for, sharing your personal story. Yes, these over-the-counter medications, like Advil, ibuprofen, stuff like that, and a lot more medications. Our recommendation as doctors is that even though they're over the counter, still ask your primary care doctor if they are okay for you to take. Because if you have high blood pressure and you're taking any of this, we call them NSAIDs, non-steroidal anti-inflammatory agents. If you're taking any of them, they're bad for you. Apart from even still increasing your blood pressure more, they can also cause you they can destroy your kidneys. It's a lot they can do. So we're glad you're here. And I'm so excited. I didn't want to say before, Dr. Bankole is my daughter. So proud. Okay. Now I'll behave myself. Auntie Tower, please unmute and ask your question.
Good evening, everyone. Dr. Bankole, you did a good job in analysis. Thank you very much.
Thank you, ma'am.
You're welcome. While you were talking, you mentioned somebody that was in the house and probably been unconscious for 8 hours. And you said the husband said there was an odor. What has that got to do with what happened to her?
Thank you, ma'am. So in that presentation, from what we can see on the result of that was that she had a brain tumor.
Oh.
She had a brain tumor that started bleeding. So the husband said few days before that, she was having this particular smell. So sometimes with a brain tumor, depending on the area of the brain it is, the brain is a map to your body. So depending on the area of the brain, the location of the where the tumor is located. So she was already having signs and symptoms of a brain tumor. So I'm pretty sure she was probably having headaches, and she was probably not, probably thought it was like a regular headache. And not really taking that as an emergency. So she was, as the tumor develops, as it grows in the brain, people start presenting with signs and symptoms. And so the smell she was having was because she had the tumor in that location of her brain that works with the smell part of the brain. So
She wanted to say it.
I wanted to say the medical word, but I was
Told
trying
me
to.
not to use medical lingos. The olfactory center.
My other question is, when some people have brain edema, they open the skull and they leave it open for so many days, just wrapping it in like saran wrap. And at times they have to do like do a partial, like something to put on the brain instead of the normal skull. It's like skull, but it's not their skull because the brain now has become edematous. So what will happen to those people if the brain doesn't shrink back to normal size?
So your question is that if they have removed that part of the brain, what happens to that part of the brain?
No, they did not remove it. You know,
Okay.
I guess they have some trauma and the brain was swollen. So they opened the brain to release the pressure.
Release the pressure.
Exactly. And they left it open for many days.
Okay.
So I'm saying now, when the brain doesn't contract and become smaller to fit into the skull, what are they going to do? Are they going to leave it open like that forever? Or are they going to create a mold? Or what are they going to do? I don't know.
So, Auntie Zawa, you're talking about a craniotomy where they actually
Yes.
open
the skull.
Well, it would have to be per the patient. That's a difficult one to answer. So one has to have that patient, have the scenario, and to know how to answer that. But yes, that's one of the ways to treat these bleeds. Earlier on, we know that, intervention was also discussed out that borehole is the usual treatment to drain these bleeds. But, when you have extensive bleed like that, craniotomy is done, but it would have to be case by case.
Thank you.
Thank you, ma'am. Thank you. So, Mr. Samsung, what's your name, please? Kindly unmute and tell us your name.
Thank you very much. I'm Makitono Emmanuel from Nigeria.
That's my, oh my gosh, my brother,
wonderful.
my own brother from Nigeria.
I am quite very proud of you.
Thank you.
Since I joined this program, actually, it has been very informative and very resourceful. I want to really congratulate Dr. Shola for this brilliant presentation. Even though the slide, I could not see the slide very well. The fonts are too small enough, too small. One cannot really say it properly. I really enjoyed it and very proud of you people. But I have some questions to ask. One, can this brain bleeding hereditary or genetical? Two, could there be any preliminary symptoms that a layman can notice before it is reported in the hospital? Because sometimes you cannot really tell. You just feel some pains and you don't know that the gravity is so much. Then number three, can stress or overworking or tension, not BP this time around, for some of us that read a lot, wake up in the night, late night, keeps late night, do vigils, do all these sort of things. What impact does it have on this brain bleeding thing? Thank you very much.
Thank you, ma'am. Oh, thank you, sir.
He's a professor and a pastor. So yeah, he does read a lot. He's a doctor. So go ahead.
Okay, thank you, ma'am.
Is it genetic?
Yes, ma'am.
Can this brain bleeds be genetic?
Okay. Yes, sir. Thank you so much, sir. Sorry about the font. I guess it wasn't showing that big up there. But one of the ones we know that can be genetic is the brain aneurysm, especially with patients who have polycystic kidney disease. It's been known that if they have a history of polycystic kidney disease, which is an autosomal recessive disease, most of the time they do have brain aneurysm with it also. And so that can be passed from one person to another also. And so if there's anyone in the family that has had brain aneurysm before?
No.
No, we don't have any in our family.
We don't have any.
Yeah. He's my first cousin.
Okay.
I think he's asking for knowledge.
For knowledge-wise, yes, ma'am. So I'm saying if there's anyone in the family that have had brain aneurysm, or for any person that you know of, if they've had, then the person who wants to know can also get checked by doing MRI of the brain or something like that. But brain aneurysm is one of the ones we know that is hereditary. But for the other brain bleeds, they are usually not hereditary or genetical most of the time.
What about stress?
What about the symptoms? It says, are there symptoms that one can look out for before disaster actually occur?
So the biggest one, and the one that is very particular, is the headache. And then sometimes we're having a headache and we're like, it's just migraine. But if you have a headache that is not going away, even after taking, just like I think one of our daddies that mentioned earlier, the symptoms he was having, like he was having a severe headache, he took her leave, still was not going away. Thank God his wife took him to the emergency room. And we thank God he's still alive, because bleeds like that can become deadly. So if you're having severe headache that is not going away, sometimes people, the headache on one side, when you bend down, you're feeling dizzy, or when you wake up in the morning, you're having headache and it's not going away. It's always good to get check out. For me, working in the emergency room, any patient that presents to the emergency room with me with headache, I usually just get a CAT scan on them. In this day and age, we cannot miss a brain bleed just because we have the technology for it. Especially in the United States. I don't know about Nigeria right now, but headache is one of the #1 symptoms that people present with. They start having headache. Now, if you're having nausea, vomiting, or you're feeling dizzy, sometimes when people are throwing up, we think it's from the belly. It's not necessarily the belly all the time. If you're not having any belly pain with nausea, vomiting, and persistent nausea, vomiting, then that is a sign to go get checked. Another sign that it could be, another sign that we usually see, another symptoms we see is dizziness, people feeling dizzy. Or sometimes is the very first time people will have seizure. Just having seizure, that is another sign for it. You had mentioned stress and body rest. The funny thing about the body is that when your body is overstressed, the body has a way to shut you down. Most of the times, people will develop a stroke just from being stressed. Now, a stroke could be a bleeding stroke, or it could be the one we call the ischemic stroke. So it's always essential we give our body rest, because the Bible says is our body is a temple of the Holy Spirit. So we have to take care of our body also. So when we need to take that rest, we need to take that rest, and we don't want the body to shut us down. So
thank you very much.
Thank you.
You're welcome. Thank you.
Thank you, sir.
Dr. Izugu, kindly unmute and ask your question. Thank you.
Dr. Thank you so much for your presentation. It really came at the right time. This is a Black History Month, and also Heart Disease, American Heart Association Month, and of course Valentine's Month. And the thing is that you you hit on the head of something that really kills a lot of people in Nigeria and other places. As you mentioned, hypertension is actually the number one cause of intracranial bleed. And that affects tons of Nigerians. I mean, look about maybe up to 70 million people affected by hypertension, and some of them don't even know that they have hypertension. And hypertension, I mean, there are many things that can lead to that stress. There are family history for that runs in family, and the type of things people face in Nigeria. And that same hypertension is a major cause for aneurysms, okay, in different parts of the body, brain, other vessels, aorta, anywhere. So that you find that hypertension is the prime driver of what you are presenting to them. That if we can at least early detection and managing hypertension appropriately, we can actually reduce this significantly. Many a time, some people in Nigeria will just die suddenly and they say somebody killed them. But it's just hypertension and bleed. It's just the complication of hypertension. So the questions about family and all that, if we can really early detection, begin to check this blood pressure, take the managing it, we can reduce this type of situation. Again, thank you so much for bringing this again and discussing it. And we don't have all the distance in many places of Nigeria to even do, even if a person bleed, to even recognize it early, or even get in a CAT scan, or even go to do a brain fall. I think we have none of those in many places. So prevention becomes our key. Thank you.
Thank you, sir. Thank you so much, sir.
Welcome.
Thank you so much. Dr. Mayowa, welcome. Kindly unmute and ask your question.
Oh, thank you so much, Dr. O.
Thank you so much.
Thank you, Dr. Bankole. That was very inspiring, and it actually hit home for me because my mom actually passed on from ruptured aneurysm about a year ago. And like you rightly said, she struggled with, she was on medication for high blood pressure for a very long time. Was supposed to be controlled, but she's taking the med. But my question is there an assessment, evaluation, a test that could have revealed aneurysm? Because we did not know until my mom fell. We didn't know that she has aneurysm. And my mom, she was somebody that go to the doctor faithfully. She did all the tests, everything, that the doctor prescribed was done. And I was just wondering, is there a test that could have been done to discover? Maybe you said it before, I'm sorry if you already mentioned it before, and I missed it. So that's my question, just for the benefit of other people and also for me. Thank you.
Thank you so much, man. Sorry to hear about your mommy. I don't know of any test that they can use. I know of the genetics test for polycystic kidney disease that they can check you. They can check. Only if maybe your primary care doctor just orders an MRI out of the blue. But I don't know of any. I don't know if there's any doctors on this forum that would know of any kind of test to diagnose aneurysm.
We don't have any that I know of, unless there's symptom. When somebody, like you said, when somebody presents to the emergency room with a headache, usually they will say it's the worst headache of their lives. We do CT scan at that time. There is no test like checking the blood sugar that one diagnoses diabetes when the person does not know that they even have it, or thyroid test when they don't even know. We don't have anything like that for this brain aneurysms and even brain cancer. They're not routine. It would not make sense. Insurances will not even pay for it if we don't have reason in the primary care sector to request such tests. We are limited, much limited than people know. We're limited in the tests we can order. Every test we order, even the blood test, we have to have reasons for before we order them. We have codes that we have to provide in order to do these testings. We call them ICD-10 codes. Otherwise, the test will not be done, or the patient will be stuck with a bill. For something like CT scan, MRI, they won't even get it done. We order stuff like that from the clinic, and they would tell us insurance will not pay for it, so they can't get it done. So usually in the emergency room, when people present with symptoms like that, then they can do it. But as Dr. Bankole has stressed, since mom had it, it behooves you and your siblings to, get tested. At least to know if there is aneurysm there or not. If somebody is detected to have aneurysm, if the aneurysm has not ruptured or is small, standard of care is that we follow with routine or regular CT scan, and the neurologist will decide how often that should be done. So that can be followed, so it can be prevented. Or if it's caught at a point where intervention is needed, or it grows to the point where intervention is needed while they're screening, they would actually, what's it called, Dr. Bankole, they would clip it.
Yeah, they'll put a cord in there or clip it.
They'll clip it to prevent a bleed or a rupture. So it's very important that you and your siblings follow up on that.
Thank you.
Thank you. Thank you for asking the question. I've been there. I want to know. It's important to know. You always ask the question, did we do enough? Did we miss something? You didn't. Dr. Izugu, you wanted to say something? I saw you've been
Yeah, sorry about that. Yeah.
I'll come to you next.
Sure, sorry about that. When it comes to, let's say, abdominal, aneurysm and stuff, for patients who are like smokers and age over 65, we could screen for that with just even an ultrasound, and that, as a part of one risk assessment, then could be paid for. You could do that. But for intracranial ones, it's a little tricky, as Dr. O have already indicated. Yeah.
That is true.
Good to know. Thank you.
Thank you. Madam VP, Madam CEO. Welcome, ma.
Good evening, gorgeous. How are you?
Fine, thank you, ma.
Dr. Bankole, excelente.
Thank you so much, ma. Good evening, ma. Thank you, ma.
Good evening. My question is, all this CT scan, ICT, and all of this scan, how safe are they for the brain? How often should one be subjected to? Because I'm very scared of radiation, and I've been told that this CT scan, what is the other scan? I forgot the name. MRI.
Right.
That they could be dangerous or something to that effect. So please educate me.
Okay. So MRI has one of the lowest dose for radiation. And so, but what I tell people is, as long as you're not getting a CAT scan every month, yes, CAT scans they do carry radiation. I work in emergency room, so we do CAT scans on a lot of people. They do carry radiation, but if you have to weigh in the risks and the benefit, right? So for like our daddy had talked about him having severe headache. And usually when you go to the emergency room, we screen you actually. We just don't do CAT scan on everybody. We do screen you. So if you present like our daddy earlier who was having severe headache and the pain was not getting better, and you came to the emergency room, the number one thing we'll do is CAT scan.
Okay.
Because it saves lives.
Okay.
You're waiting for the radiation effect, you're waiting 10 years from now. But if you look at the risk of saving a life right now, Yes, the radiation exposure is there, but you can save a life right now.
Okay. The reason I'm asking is, migraine headache, unfortunately, is one of the things I inherited from my father. From age 15, I've been having it. I do have severe one. It's like almost a monthly episode. But once I sleep and take Tylenol, it could last 3 days. Then I get okay. But I've been thinking of going for this scan. But I've just been apprehensive because of all the other comments that I've had. So you're saying it's not that bad.
I mean, for your case though, because you have migraine and you know it's migraine, what I'll probably recommend is getting an MRI. Because it's a headache that's been going on for a long time. I'll recommend getting MRI. And
Yeah,
if you're
for over
about
40 years. Yeah.
No,
for a long
MRI does not have radiation. It uses magnetic fields. That's
Okay.
why if you have any metal on you, you are asked to remove them before an MRI. If you have metal in your body, say somebody had fracture and they fixed it with an MRI, with a metal rod, they cannot have an MRI.
I see. Okay.
Because it's magnetic field that it uses. So, and Dr. Bankole is right. It's MRI you need because you have migraine headaches that has been established.
Okay. Thank you.
You're welcome, ma'am. Dr. Lola, kindly unmute. There you go. Thank you.
Thank you so much, Dr. Bankole. Great presentation.
Thank you, ma'am.
Because I was going on the same note that Madam VP just said, because there are different kinds of headaches, sinus headache, migraine, like she said. Some is due to insomnia, some is due to constipation. Because we have sometimes some patients that come in and say, I have headache. I don't know if I should be telling everybody, once you have headache, go to the emergency room. Please clarify specifically which of the headache makes it so. I know when it's severe, but some will have it for days too. And they were asking, oh, can I just take over-the-counter medicine just for the headache to go away? But I asked some questions. How many hours of sleep did you have? Are you constipated? So I want to be able to know which of the symptoms you talk about, nausea and vomiting, without the only two things that I need to look out for before I tell anybody to rush to the emergency room, please.
So everybody will present differently. Some people might just have mild headache or sinus-like headache. So it's really difficult to know who to tell to go. I had a case recently, about a month ago, of a patient about 80 years old. He saw his nurse practitioner and he was having headache. And the headache sounded like a sinus headache. And he saw his nurse practitioner. She gave him some azithromycin to treat sinus infection. And the man was not getting better. He came to the emergency room. And his headache sounded like a sinus headache. We did a CAT scan on him, and this man had a massive brain bleed. So you can imagine he's been sitting on this brain bleed for over 2 weeks now after seeing his nurse practitioner. So it's really difficult to call which one you send to the emergency room. If a patient is looking stable, they don't necessarily need to go to the emergency room. They can go see their primary care. If they're looking okay, they're looking well, in good condition, the headache is just mild, they can go see their primary care doctor. They're worried about the emergency bill. There's no weakness on one side, they're not sluggish. They can see their primary care physician who can order an outpatient CAT scan. Those ones are usually not expensive. Or they can order an MRI as outpatient instead of coming to the emergency room. And usually in those cases, when they see anything emergent, they will notify the patient immediately to go to the emergency room.
Okay, thank you.
Thank you. Thank you so much. Dr. Ajagbe, kindly unmute, sir.
Hello. Excuse me. Thank you, Dr. Bankole.
Thank you, sir.
That was very illuminating. I just want to chip in one comment, and that's to say that there are some screenings for brain aneurysm. The first of them is called CTA. So it's a CT scan with angiography. So there will be an injection of contrast medium that will actually go to the brain and will map out the blood vessels. And the CT scan can actually bring that out so that it will be more easily discernible at the level of the tiny blood vessels. So that's one. The other one is also an angiography that is using magnetic resonance as well as radio frequency. So the two of them together can actually generate. That is the safest and that is the non-invasive approach to screening for brain aneurysm. The other one is a little bit similar to the CTA. That one is the digital extraction or digital subtraction angiography. So that one also uses the injection of contrast medium. So those are the ways by which anyone who has a family history can actually go in to have a screening done for such, using such techniques.
Thank you, sir.
Thank you so much, Dr. Jagbe. Thank you for that. For that, but it's still the same thing. We sometimes insurance will not pay for it. The best place to screen for these things is emergency room. From our standpoint as primary care physicians, there's no way I'm going to be able to get these tests unless there's symptom and insurance approves it. That's the problem. Medicine is ruled by insurances today, unfortunately. Even medications we write, we have to do prior authorizations a lot. I did 2 today, very annoying. Somebody who is not a physician making a decision on what my patient gets or not get. It's tough. But, I think personally, if somebody has any symptoms and they're not sure of it, go to the emergency room and let a doctor properly evaluate you so that, if there's a problem, then they can detect it and fix it early. But Dr. Jagbe, the problem is the access. We don't have access.
Yeah, I understand that. It's just that to know that such techniques are available.
Yeah. It's the access. It's insurances allowing it or the person being able to afford it. Thank you so much, sir, for the input. So in the chat box, Dr. Alu asked, can a patient who is treated from brain bleeding resume normal life after recovery?
So it's possible. I gave an example of the son-in-law to the elderly who had a subdural hematoma, subdural brain bleed. But because the son recognized he was having a brain bleed, brought him immediately to the emergency room. He was immediately taken for surgical intervention. The brain bleed was taken care of, was evacuated. And afterwards, he had occupational therapy, physical therapy, rehab. And within 30 days of that incident, he was able to back to his normal life. So it's possible to have a good outcome from it if the diagnosis is rapidly, if there's a rapid diagnosis, number one, and immediate emergent intervention is done. It's possible.
Thank you. So, Auntie Susan Oshifade said, this was a brilliant and educational session. She said she's proud of you. And then she said, please, how do we differentiate between the different headaches to know which one might be due to a ruptured aneurysm? Will you recommend we demand a test? What is the text called? On a regular visit to our practitioners. And I think the question has been answered, right? That there is no test really. And differentiating between the headaches. If you have an headache that is the worst one you've ever had, I think you should go to the emergency room, right? Okay, I'll defer to you to maybe add to the different kind of headaches, right? We've talked about the different headaches,
yes,
but is
ma'am.
there...
Yes, ma'am. Yes, ma'am. Just like Daddy just said right now, also, if you're having a headache and you go to the emergency room, you know, we can do a CAT scan, we can do a CTA of the brain, we can do a MRA also of the brain, and just to check for if you do have a brain bleed. So,
yeah. Thank you. So I have this that, you know, this is incredible. One of our Medical Mondays family had subarachnoid hemorrhage, right? She said time was of the essence. It was spontaneous. She had flash of lightning, stiff neck, she thought it was a joke. She was glad she works with great nurses who recognized a stiff neck and called 911. She was in ICU, hospitalized for 2 weeks. To the glory of the Lord God Almighty, when she was given her HX. I don't know what that is. HX, are you familiar with that? Okay. They looked at her and asked what her deficits were. And her response was none, to the glory of the Lord God Almighty. Unfortunately, none of the noted causes could not identify a cause of her bleed. And she said there was none of the noted causes that was discussed tonight. So, and also they could not identify her bleed, but she recovered and she's doing well. But what I think is also important here is she talked about symptoms, what she had, because it's important if somebody else has that to go straight to the emergency room. Don't go yourself, please. Don't drive. Call 911. Spontaneous. The headache was spontaneous. It came acutely. She had flash of lightning and stiff neck. So Mr. Lawal said, thank you for this very rare but highly informative presentation. He wants to ask if minor bleeding in the brain can reverse itself and become totally inconsequential without necessitating any clinical or surgical intervention.
yes, ma'am. So usually minor bleeding, what we usually do is most cases, some patients will have minor bleed and they don't have symptoms from it because it's just minor, right? And some cases when we have patients that present with a minor brain bleed, we keep them overnight in the ICU and we monitor them. We recheck the CAT scan again in the morning. And if there's no change and it's getting better and their blood pressure is better, they get discharged just for it to resolve. And I mean, the brain is a good thing, just like the body, it will eventually heal itself if it's a minor that doesn't need a surgical intervention.
So thank you so much for that. Auntie Susan Oshifade also said something about non-steroidal anti-inflammatory drugs. I think she wants you to say something about that again.
Oh, okay. I think what was mentioned earlier was that the non-steroidals, right? They are also they can also lead to bleeding, right? They can increase the bleeding, not necessarily increase, but they can lead to bleeding also, just because they are they have anti-platelet effect. And so they kind of work against the platelets in our body, right? So because they have an antiplatelet effect, they can also increase, lead to bleeding also. If it's taken, I'm trying to explain it. I'm not sure if I'm saying the right thing.
Say it, let me help.
Like the NSAIDs, right? They have the antiplatelet effects in the body.
So they have blood thinning effect. And if you remember, Dr. Bankole said it over and over again, that people on blood thinners can potentially bleed in the brain. So since this NSAIDs like ibuprofen, Advil, and all of that are blood, thins the blood also, then, that would be a problem in some people. So the incident I read before, there's continuation now later that, she said she did not have any prior symptoms the morning of the incident, the morning she had the brain bleed. She came to work bubbling. There was no prior warning. She went to park her car when she experienced the headache of life. She wrote, the worst headache of her life. No history of hypertension. On the other hand, she had history of low blood pressure. So what does that tell us? Then the bleed is because of another reason. It's not blood pressure. That's all that says, right? Or is there something else, Dr. Bankole?
So with the kind of bleed, it sounds like she had what we call spontaneous intracerebral bleed, which is the very first type of bleeding we talked about, that you don't have to do anything. It just happens and can happen suddenly. So sometimes when the blood pressure is low also, you're not perfusing the brain, right? So for patient with stroke, right, when they have a stroke, actually with patient with intracerebral bleed, brain bleed, we try to control the blood pressure to bring their blood pressure down. But you also don't want to bring it all the way down, because when you bring the blood pressure all the way down, you can also have an increased bleeding. Really. So there's a level we want the blood pressure, usually below 150. Most of the neurosurgeons and neurologists want the brain blood pressure to be below 150, 140 with a brain bleed, but they don't want it to be so low also. So in cases of patients with high blood pressure, or a stroke patient, actually, their blood pressure is low, we actually give them fluid just to bring their blood pressure up, to help the brain perfuse into the organs of the brain, so into the tissue of the brain.
Fantastic. Thank you. So, well done, Ma. This reads, I want to believe there is a bank for all these wonderful medical presentations that one can always reference when need be. Also want to request that this presentation be sent to emails if permitted. So we have all these presentations on YouTube and on Facebook. It is streamed, live, so you can get them on Facebook or YouTube. Just search Medical Mondays with Dr. O, and please subscribe. So another chat says, education, education, education. Warn older parents to report all falls and collisions, head collisions. A number of our Nigerian brothers and sisters walk around the clock, report home with headaches, and did not wake up the following day. She says she knows at least 2 of them. So it's true. Please report any falls, headaches. Question. Dr. Lola asks, is there any adverse effects for constant head coverings?
No, I don't know of any, ma. I don't know if you know any.
No, I don't know of any problems with head coverings. Muslim sisters, especially, who are very staunch in their faith, cover their heads at maybe 24/7, at least when they're out of the house, and they're fine. It doesn't do anything to the brain, as far as I know. So a lot of, thank yous, excellent presentation, accolades on the platform. Brilliant presentation, a lot of things. So thank you so much. This was excellent and succinct. But if you don't mind, if you bring up that book again for me in the background, I'll appreciate it. I just want to say that our speaker tonight, who is a daughter of mine, Dr. Bankole, also wrote a first book, has nothing to do with emergency medicine. She's an emergency room physician, has to do with personal experience. And I must say, if you know some about medicine, you will know that medical doctors go into specialties based on their personalities. ER physicians are noted for hyperactivity. This is where we have one aberration. She's not hyper. She's so calm, gentle spirit, and an ER physician. She reminds me of Dr. Imoke. They say surgeons are arrogant. Dr. Imoke has the best bedside manner for a surgeon. I mean, doesn't look like one at all. And, it's always a breath of sunshine when I see these aberrations. And so Dr. Shola Bankole wrote this book to just encourage and assist new mothers. Every new mother, every newly married person should have this book, because you never know how your plight may be, how your work may be. Even just reading the book may maybe even prevent cesarean section at all to start off with. So this is a great gift to gift anyone. It's very, very cheap. It's on Amazon for purchase. I purchased one already, and I know I'll be purchasing more because it's an excellent gift to give. So thank you so much for this presentation tonight, and for writing Beyond Birthing Impossibilities, my VBAC journey, which is my vaginal birth after C-section journey. So if you please give us your closing remarks, that would be excellent.
Oh, yes, ma'am. Thank you so much, ma'am. Thank you so much for the privilege, for the opportunity. I truly appreciate it. Thank you, ma'am, for what you're doing, because you're doing a great thing. Just like I said, creating awareness out there. Thank you for giving me this opportunity just to present on intracranial bleeding. And thank you to everyone for listening in. And I hope and I pray that this presentation will bring a prevention to somebody and save a life. Thank you so much. Thank you, ma'am.
Thank you. Thank you so much for making the time. ER physicians are busy. The mother of four boys. And a wife, a mother, and then making the time for us on Medical Mondays. We appreciate you. Thank you. Love you. Thank you.
Thank you, ma'am.
So till we see next week, please stay safe. People are still coughing. They have COVID. There's still influenza out there. RSV. Can you imagine? So stay safe. Avoid close enclosures. And may the Lord keep us all safe till we meet again next week.
Hey, Dr. O, I'm quarter Chinese. You didn't say Happy New Year to me.
Thank you.
Happy New
Bye.
Year. Happy New Year, Chinese family. And especially you, Madam VP.
Gong Hei Fat Choi.
Sorry.
Yeah.
No, thank you.
It's way Gung Hei Fat Choi. That's the Chinese.
Thank you.